Hello, this is Life Coach Angelia with part 8 of Works of Heart's Teen Pregnancy Life Coaching Program. Last time we were talking about general considerations involving pregnancy, so we're going to continue with that. Currently identified risk factors for depression during pregnancy: low socioeconomic status, non-insured status, lower education, unemployment, unmarried women, African American and Hispanic women, adolescents, past history and/or family history of affective disorder, decreased social support and maternal isolation, negative life events, marital conflict and presumably family conflict, ambivalence about the pregnancy. As discussed above, the effect of maternal stress and psychiatric symptoms may be quite significant in terms of the well-being of both the mother and the fetus or child. Because if she is not mentally healthy, then she's not going to be a good mother to that child. And that's why we're doing this to begin with, to get her in a place where she's going to be a good mother to that child, so this child can have a good outcome, and so can she. Critical issues involve severity of symptoms. How bad is it? Degree of woman's distress. Is it something that's really bothering her, or, maybe not so much? And level of functional impairment. There are some people who, they don't even want to get out of bed. So that's a problem. Along with the nature of risk factors, not the number of symptoms per se or presence of specific diagnosis. Because up to this point, they might not have had any diagnosis. They might just be depressed because of the fact they got pregnant and their parents or, peers, whoever's coming down on them. It depends on how the pregnancy came about, whether they're happy about it or not. There's a lot of factors that can, come into play there. Emphasis on the clinical significance of symptoms. Women depressed during pregnancy are at heightened risk of postpartum depression. And as we know, that's a big problem, that people don't want to talk about. Mothers feel like, I should be overjoyed, I should be happy, but I'm not, I'm depressed. It's me, something's wrong with me. And that's not the case always, So if they're showing depressive symptoms now, that's something to address so that, when the baby comes, they don't have such a hard time, dealing. Pregnant women with clinically significant psychiatric symptoms and or high risk should be identified and offered support. You certainly don't want to, say, oh, well, I can't work with you because, you're mentally ill, go get a therapist. You still want to work with them, but you want to have a therapist as a referral source. You have a therapist on board so that, you can help this person, because what we all want is the good outcome for this mother and child. I don't know what is going on here with this thing. There's flashes. I don't know. With referral, again, for treatment is indicated. Again, you want to have a therapist, counselor as a referral source. You can have a bunch of them, honestly. There's been a bunch of people approach me, and so I've got like a whole, referral binder back there of people who, are willing to work with people that I work with or worked with, General considerations involving pregnancy. Symptoms of greatest concern during pregnancy include the following: feelings of guilt and hopelessness. So, especially if the family is, on them about, done the wrong thing and got pregnant, they may have great feelings of guilt, and they might have hopelessness for the rest of their life because, some of them might be told that you ruined your life. This is your life now. You have no hope of having a life. You ruined your life. I've heard that told to people, and I think that's sad because if they have a supportive family and supportive parents, this isn't the end of their life. It's just another thing in their life that they're just going to have to deal with, Inability to enjoy anything. There's a name for that called anhedonia, but we're just going to say, inability to enjoy anything. They have a general depressive, bad attitude. My kids always call it emo. But definitely that's a sign that there's a problem there. They're probably depressed. Presence of neurovegetative symptoms. If they're laying in the bed all the time, if they're not wanting to do anything, again, that's a problem. Or if, they say they can't, I can't move, that's a problem. Suicidal thoughts, of course, that's a problem. And history of past depression. If kids already had depression, is on meds, and then, they get pregnant, and they're having more depressive symptoms, then that's, a definite problem, because then that means when the baby comes, they're not going to be there for that child and able to take care of that child. So that's something that definitely needs to be addressed. Symptoms less specific for depression can be due to possible emergence during pregnancy, because again, hormones come into effect, and you can get depressed and upset and cry easily while you're pregnant. Sleep disturbance, appetite disturbance, fatigue, change in libidos, can be more, can be less, and if they're used to sleeping on their stomach, of course, that's not going to be a thing anymore, because they got a baby in there, so they're not going to be able to sleep on their stomach. The primary principle guiding a treatment decision, determining the risk-benefit ratio, providing treatment with its possible adverse effects. Because, again, there can be effects if they're, put on medication. Some of these medications are not okay to take during pregnancy. They definitely want to be their own best advocate there. And again, if therapy is bringing out a lot of traumatic stuff for them, this is not the best time when they're pregnant to bringing all this stuff out. And then, compared to no treatment, the risk of impairment of the woman and fetus child. So there has to be some weighing there. Is now the time to do this? Is now not the time to do this? Because you might mean well, but now might not be the best time to do this while she's pregnant. You might have to wait till afterwards. Decision needs to be collaborative with the women and family. Again, if you can get a supportive family on board with this girl, that's great. And a lot of times why, a teen pregnancy life coach is even called in is because there's problems communicating with the teen and the parents. And so you can kind of bring them together onto the same page. Whereas, the teen is, just not wanting to listen to parents right now. And some parents are, coming down on them. And so you can't really blame them. In general, experts recommend active treatment. Excuse me, my nose is itching here. Given significant risks to mother and child of untreated severe psychiatric symptoms. The goal of treatment is establishing a normalcy, so that they can get over, whatever's going on in their head, so that when the child comes, they are then able to be a caring parent to this child. Recommend non-pharmacological treatments include the following. Again, some of these drugs they cannot take when they're pregnant. Supportive psychotherapy. So as again, you need a therapist as a referral source. Cognitive therapy. There are a lot of, therapists who do this. And interpersonal therapy. Again, that's, something. And again, that's something that you're doing with them because you're coaching them through this pregnancy. Use of psychotropic medication. Again, you can't use them all. Caution. Use of lithium during pregnancy and women likely to become pregnant. So lithium is a problem. So that's not something they need to be on. Many studies to date indicate absence of significant risk to fetus and child. With use of SSRIs, that's a type of drug, though additional long-term data has not been, researched thoroughly. No increased risk of miscarriage or congenital abnormalities. No complications in delivery. No evidence of risk for cognitive or behavioral problems during later development, referred to as behavioral tetrogenesis. So some of these drugs are okay to use during pregnancy, and some of them are not. Caution in discontinuing SSRI if woman is already on it prior to pregnancy, because the last thing you need is for her to go off her meds, and then to just have major problems in life, not to mention the fact that they're pregnant. Relapse could occur, of course. Caution in discontinuing them. And here's the ones that they recommend for use during pregnancy. Prozac, Celexa, and Lexapro. If women is on another SSRI, consider switching to one of these. And if starting, use one of those. Psychological aspects of adolescent pregnancy. The meaning and degree of potential risk of an adolescent pregnancy needs to be understood in terms of multiple factors, including the youth's cognitive and psychosocial developmental levels, because they're not all going to be the same. You might have a 17-year-old that's got the developmental level of a 13-year-old. You might have an 18-year-old with the developmental level of a 16-year-old. They're not all the same. You need to kind of get a feel for where they're at, and studying human development will help you do that. And kind of chart them. Well, I think their mental and emotional age is about here. And then you kind of work from that point. And of course, if they're more mature in more areas, then you can speed up on that. But that's the goal there, is to get on their level and deal with them on their level. Because if you're talking way over their head, that's not going to do them any good. Socioeconomic status. If they're not in a, well-to-do or, moderate income family, they're going to have, less opportunities, and you have to think of that when you're, planning things. Culture and religious beliefs. Culture does play a part. Religious beliefs do play a part, because a lot of people believe, premarital sex is a sin. And so if that's the attitude in the family, that's the attitude that's going to be portrayed. And then if you come in there and start, saying that's not the case, then of course they're going to fire you. So you have to work out of some respect for people's, culture and belief systems. Premeditation and intentionality. Sometimes these girls want to get pregnant. They want to trap the boy. So sometimes there's some of that going on. I'm just going to say that almost never works out, so that's not something, that if any young girls are watching this is something you want to do. And again, it's a faulty belief system. If they think, oh, if I get pregnant, he'll have to stay with me. Well, no, of course he does not. He might decide to be in the baby's life or not, but he definitely doesn't have to stay with her. But this is a, immature belief system that caused her to say, oh, well, I'm going to get pregnant and that way he'll have to stay with me. So you might have to deal with some of that. Psychiatric states. Again, if they're mentally ill, that's going to play a part in how you deal with them and how they can be dealt with. Family relationships and the level of support. Like I said, hopefully, I've met a few people who had great, supportive families and who are willing to help them, and to help them take care of their child. But then there's so many more who are not, so you have to get a feel for mom and dad and the family and see what's going on in the household, to be able to come up with specific ideas to help them. Ability of the youth to acknowledge the pregnancy. Not all of them want to admit that they're pregnant. Some of them kind of go off the mental deep end and I'm not pregnant. They just think I'm pregnant. I'm not really pregnant. Well, if the doctor says you are, then chances are that you are. And you have to kind of like I said, that counselor, on as a referral source is a good idea. Level of achievement and goal directedness. There are, valedictorians who get pregnant. Stuff happens. And if they have some achievements under their belt, and if they have a goal they want in their life, they're going to be more positive about being a parent because they know, okay, I've got this kid now, I'm going to take care of this kid. But I can also, go to college or get a job or whatever. And that also goes back to the supportive family. If they have parents who are still supportive of them and will help them go to school and you work and things like that, that's a definitely better outcome for them and the baby than if they don't have that. Risk and protective factors and direction of the overall balance. Again, if they are taking silly risks, like doing drugs or alcohol or whatever, that's danger to them and the child. And if they're, taking care of themselves, like if they're carrying themselves, protectively of the baby, that's a good sign. Level of resiliency is demonstrated in the past and present. Again, how do they overcome things? Because some people are resilient, some people are not so resilient. I've met some people who are really not resilient. And it's sad because they're not going to have a good outcome because they can't overcome things and get over them and move on with their life. They're stuck. And some of these people have been to therapy for years and are on psychotropic medication and still cannot manage to get past things. So that's really sad. But you might come across some people like that. Possible dynamics, motivations, and causes related to the onset of an adolescent pregnancy may include any of the following, alone or in combination. Desired pregnancy based on reciprocal relationship. Again, some of these girls are so in love, that they want to have this boy's baby. Isn't that romantic? No, not really. But some of them have this idea in their head, so that might be something you have to deal with when you're coaching them, is bring them a little reality, gently. Everything when you're coaching people has to be gently, unless you come up against a brick wall, and then sometimes you got to get the hammer out and hammer on the wall, and you either get let go or you make a dent and get through. Pregnancy is a vehicle to emancipation or adulthood and or respect, especially if they're being told what a kid they are. And there are girls who get pregnant to be seen as an adult. That's a shame. That's a statement against their, surroundings, but it happens. Unpremeditated or impulsive action. Again, when you're a teenager, you're not doing a whole lot of thinking, and there's a lot of impulse, decisions made. So it happens. Sexual victimization by a partner. There are girls who are raped and get pregnant. Sexual abuse in the family. There are girls who are sexually abused, raped by family members who get pregnant. And that's why I am for abortion as a remedy to this. I'm not for abortion as birth control. But if a 12-year-old girl gets raped by a family member, yes, I think it's a good thing to go ahead and let that child have an abortion. If your 17-year-old was coming home from school, got gang raped by, 4 guys, then yes, I feel like, you should allow that girl to have that abortion. Because what you're doing is you're adding trauma on top of trauma by making a child, and this is mostly in a lot of religious homes, making that child have that baby. It was not her choice to have that baby. 2 people, they know how to make a baby. Most everybody over the age of, 8 or 9 knows how to make a baby. So if you did a thing to willingly make that baby, yes, then I believe you should have that baby. If you don't want to keep the baby, you can give it up for adoption. However, if a man perpetrated an evil act against you, that's man's and the devil for talking him into his fault. So I do not believe an innocent girl should have to pay for their action. So that's why I believe that in those cases, abortion is a medical procedure that rids her of the sinful act that this man and the devil perpetrated on her. Depression and or hopelessness about the future. Of course, if they don't care, if they're depressed, the guy's like, let's do it. And she's like, okay, I don't care. It happens. Impaired judgment due to a psychiatric disorder. With whether they know it or not, whether they've been on meds or not, and, they're mentally ill and they're not thinking straight and they're like, who cares? Let's do it. I don't care. Disinhibition as a result of substance use. Again, drugs and alcohol is the gateway to, teen sex. Limited sexual knowledge. That's one that goes around a lot. You can get pregnant on your first time. The pulling it out as he's about to come, and he might promise that for all the world, but that doesn't always mean that's gonna happen. So, there's a lot of myths in middle and high school, so you need to make them aware of the actualities of things. They already found out, this way, so, you want to prepare it in the future. The outcome of a pregnancy for the parent and child depends on multiple factors, including level of interpersonal support available to the pregnant youth. Like I said, if she's got a good family, if she's got positive peers around her, she's going to have a better outcome than if she has negative ones. And that's why you're coming in, is to teach her, some good life skills, to take care of herself, to love herself. Oh, excuse me. Excuse me. And, to be able to care for this child, to catch her up developmentally so that she can be a good mom. Response by the primary family members. If the world caved in on her when they found out she was pregnant, that's going to be damaging to the relationships. You might have to do a little damage control. Degree of safety and stability provided by the home. Again, if she's in a good home and it's a good situation, that's going to be so much better than if she's not and it's a bad situation. That's, when you might have to step in and, call people in. You hate to do that to a pregnant teen, but if their safety is a question, CPS can certainly get them to a place where, they're going to be safe. The community they live in, again, if they feel safe in their community or not, and their primary relationships with people. Ability and willingness of youth to acknowledge the pregnancy. Again, there are some people who just go right into denial mode, and they're like, they're getting this baby belly, but they're like, I'm not pregnant. I don't know what you're talking about. Accessibility of prenatal care. They might not know where they're going to get care, and you might have to, help them do a little research on that. And nature and continuity of care provided. If they're going to a clinic, they might say, once you have the baby, you need to go to another doctor. You need to get all the facts with them. Ability and willingness of the youth to obtain education and receive prenatal care. Again, if they're in a good family, they will let them continue to go to school and go for their goals, and they will encourage them to go to prenatal care. Level of impulse control of the youth. Again, in your teenage years, you're not super good at impulse control, so that's something you need to impress upon them. Degree of use or reliance on drugs and alcohol. Again, you should not be using any drugs or alcohol when you're pregnant. You need to impress that upon them. Cigarettes, that's hard on your baby. You need to talk to them about that. Willingness, capacity to discontinue or decrease these activities. You're going to have a healthier baby if you don't smoke. You need to impress these things upon them. And there's so much information out there. Of course, you can get handouts and things to give them to them, to help them have the healthiest pregnancy that they can and the healthiest baby that they can. Nutritional and general health of the pregnant youth. If they were in bad health to begin with, this is not going to be helpful to them. The impact of the pregnancy, an added stressor. If they've already been under stress and now this has happened, they're going to be under even more stress. A source of confirmation. Again, they might have done this to confirm I am an adult. No, not necessarily. You're just sexually mature. That doesn't make you an adult. The youth's self-image and emotional status. If she's already gotten a bad self-image, getting pregnant and having this belly coming out is not going to be helpful. So you need to work on, healthy things, like diet, gentle exercises, things to help them to be healthy, that they can understand, I'm pregnant now. This is what's going to happen. My body's changing. It doesn't mean I'm fat, because that's, the first thing mean girls want to throw at a pregnant girl is, you're fat. Look how fat you're getting. And, that's something that you're just going to have to tell them, this is life. Don't listen to them. Their degree of empathy and including ability to envision themselves as pregnant. Some of them, like I said, have a problem with that. And if you've been a mother, that's also helpful. Because you can say, well, when I was pregnant with my kids, and then they realize, oh, well, you know what you're talking about. You're not just some lady who's just telling me stuff because you got it out of a book or whatever. You know more, than someone who doesn't know, The psychological aspects of, adolescent pregnancy, particular issues of potential concern, to inquire and educate about, and to monitor. Psychotropic medication use during pregnancy. Again, like I said, there are safe drugs, there are unsafe drugs. And you're going to, want to tell them, okay, what are you taking? Does your doctor know you're pregnant? These are things that need to be addressed. Effect of alcohol on the developing fetus, fetal alcohol syndrome, and, FAE. Again, you can get handouts and show them these things, and hopefully discourage them from drinking while they are pregnant. Effect of smoking on developing fetus and mother, possible placental abruption. That's something that can happen. Again, you can, go on the internet, get handouts to give them. Ectopic pregnancy. Again, that's something that happens anyway, but it can be a worse thing with smoking. Miscarriage, stillbirth, maternal infection, because tobacco use lowers your ability to heal. Prematurity, reduced breast milk, infant death within the first 28 days, and that's, SIDS, because they believe that smoking can contribute to SIDS, and infant death in the first year from SIDS, which is, sudden infant death syndrome, SIDS. Effects of drug use on the developing fetus. Again, you can get handouts and give them to them. Possibility of domestic violence or other victimization of the adolescent. Again, a lot of them think, I'm going to get married now. I'm pregnant, and they get married, and they end up in an abusive situation, or they're getting abused in their household because they got pregnant. So these are things to keep your eye out for, and be able to, intervene if necessary. Denial of the pregnancy by the adolescent. Of course, if they're denying 100% that they are pregnant, they do need some psychotherapy. They need some help to come to grips with this, because they're going to have a baby. Poor nutrition and insufficient weight gain. Again, self-image issues are rampant during their teen years. If they're not eating in order to stay thinner, then that's danger to the baby. You need to talk to them about that. Physical complications or exacerbation of adolescents' pre-existing medical conditions. They had pre-existing medical conditions, and now the pregnancy is making things worse. They're going to need to talk to their doctor about this. And like I said, you can be an advocate, with them. If they want you to come to a doctor's appointment or whatever, you can do that. But again, you don't want to do things for them because they're already feeling, like their life has been turned upside down because, in their world it has. So you don't want to enable them to become dependent upon you. You want to coach them how to advocate for themselves and to do things for themselves. Avoidance of decision regarding whether or not to complete the pregnancy. You can only say, I haven't decided for so long. Now, in some states, they'll let you do that up until your 8th month, which I think is horrible. But, they need to make a decision. They need to start weighing the pros and cons. Do I want this child? Hopefully, if they don't want the child, they're willing, to give the child up for adoption. Again, if the child was a product of incest or rape, I feel like that is, not that was not their choice to get pregnant with this child, and they should be allowed to terminate the pregnancy. Because I've seen the other end of that, where teens were forced to have these child, and like the mother would raise it as her little sister, but then they know this is not my little sister's, this is my child, and bad things have happened later on. If they're going to keep the baby or put it up for adoption. Inappropriate attributions to the fetus or child. This baby's making me this. This baby's making me this. This baby's making me want to eat this. This baby's making me, crave this. This baby's making me sick. This, it's probably not. They can certainly talk to their doctor about these things, but, sometimes we attribute things to the baby that are not, the baby's giving me bad luck. No, that's not a thing. So, the perception of the fetus or child as an object or toy. Girls, grow up playing with dolls and I think this is being great. Oh yeah, this is great. Oh, I can't wait to dress it in this and that and make this little room for it. It's going to be so wonderful. Well, yeah, but babies also are little people. And they need to eat and drink, and they go to the bathroom and need to be clean. They need to be bathed. They wake up at 3 a.m, hungry. So, you're going to want to talk to them about the reality of the situation. This is not a doll. It's a living person that you're going to have to take care of. The issue of further pregnancy prevention. By now, they've probably learned they need some birth control. So you want to talk to them about that, what there is, what would be right for them, and to, have them know where to go get these things once they are no longer pregnant. So that's all for today. I hope you found this educational, informational. If you're going to coach pregnant teens, then certainly, this is something you can look at and write down, take notes. And that's all for now. Until next time.